Parental bereavement is the time where parents grieve the loss of a child. Currently in the U.S., an estimate of over 9,000 children die per year between the ages of 0 to 14. The leading causes of these deaths are accidents, abnormalities, assault, cancer, and suicides. Unfortunately, this leaves over 9,000 parents grieving the loss of their child. Currently, research has shown that parents who have suffered a loss of a child are more likely to have depressive symptoms, anxiety, a greater risk of psychiatric hospitalization, post-traumatic stress disorder, marital difficulties, and poor health-related quality of life. Also, the first 3 years of a child's death increases the parent's risk of mortality. There has been a tremendous increase in efforts to assist the bereaved. Some of these factors include societal changes that have changed the circumstances of death, so terrorist attacks, cancer, domestic violence, accidents, suicides, illnesses, and many others. Bereavement has been recognized as a powerful event that is both mentally and physically debilitating. As you can see, sadness is trying to work but cannot at the same time. And the bereavement process can take at least a year, if not longer. Currently, interventions that are used are mutual support groups, psychotherapy, and medications.
Just a little bit of overview of the group. So we will be focusing on self-help for our clients and guiding them to achieve a more personal growth on their level at their time. This group will be based in San Antonio, Texas. It will be an open group, so it'll be very voluntary from our clients if they'd like to attend. It will be a round-robin type of setting to give everybody the opportunity to speak if they'd wish. Due to the fact that this group is voluntary, we are going to try to get our clients through marketing, such as flyers and hospital promotions, since we are targeting a very specific clientele. The only criteria we will have for our group is that parents need to be parents who have lost a child. So a little bit about the process of what our group manual. We'll hear about the beginning phases, about the structure, how to structure, and the importance of structuring a group, especially a self-help group dealing with this sort of population. In the middle, we'll talk about working phases and the activities that we are implementing for this type of group specifically. And then, of course, we talk about the ending, termination, the types of termination in open groups, since it's different than terminating a group that can see a time frame coming. This is an open type group, so our terminations are going to look a little different, and Teresa will talk about what that means. Termination, we also, will be talking about self-reflecting and really getting to know what our clients thought about the group, since this is all support, all really client-focused. It's going to be a little bit different terminating and getting to know what helped for our clients and what didn't.
In starting the process of creating a mutual aid support group, it is important for various factors to be thought of, such as space and environment, time, and amount of members that are able to attend the group. Space and environment is important because it provides a safety net for members of the group. For parents who have lost a child in a hospital setting, research has shown that parents appreciate having ongoing communication with medical providers that were there during the time that they lost their loved one. Research has also shown that having a veteran parent who has gone through a similar shared experience is one of the most effective leaders to have in a group. The leader is then able to make decisions such as where members sit and how they sit, which oftentimes is the round robin technique. So members sit in a circle or they face each other. By having members face one another, it creates a stronger bond with other group members and it helps create in-depth relationships. The beginning of a group is also a time for members and facilitators to establish rules and boundaries for the group. This helps create a structure that will be ongoing throughout future sessions. As mentioned, leadership is important when it comes to a peer-led group. Some leadership qualities in an effective facilitator are have a leader who has group management, group process, is able to do role modeling. This means having the ability to demonstrate actions and forms of either communication or behaviors wanted or desired from other group members. An effective leader is also aware, meaning they are aware of their own feelings, and also they have the ability to tune into the needs of various families or members in the group. Part of being an effective leader is having willingness. This means having the availability and time to dedicate to the group. Agreeableness is another quality found in an effective leader. An example of agreeableness is engagement, is how the leader engages with the group. Showing empathy towards other members creates cohesiveness. In agreeableness, another quality is openness, which is when the leader is able to be mentally open and be able to share and be part of that shared experience with the rest of the group. Leader and member relationships is another important factor of a mutual support group. One of the most important elements of effective leadership is being able to push the group to work collaboratively throughout the course of the session. In order to accomplish this, open communication between the facilitator and the members of the group is important for the cohesiveness of the group. In working with a bereavement group for parents, sensitive topics such as the loss of a child benefits from open dialogue from the facilitator. The facilitator is also in charge of how the group sessions are run and how they are structured. It is beneficial for members if there is an agenda for each meeting, in order for members to add a topic or make necessary changes based on the needs of the members present at that moment. After discussing the agenda for the rest of the session, it is important for the facilitator to discuss confidentiality of the group. And research has shown that discussion of confidentiality is effective both orally and also in written forms. But it is important to remind group members at the beginning of every session, regardless of how many times they have attended, just for continuous practicing and also for any new members if it is an open group. Group rules and boundaries can also be discussed at the beginning of the session after confidentiality in order to set expectations for the group. Once the rules and agenda and any educational information and confidentiality have been addressed at the beginning of the session, it is a time for icebreaker activities to take place. Some ideas for icebreaker activities include having centering activities which focus on deep breathing while closing one's eyes. And the purpose in doing this is to leave out any stressors of daily life and leave them outside of the group. Another example would be finding a partner and checking in with them. This will help create a deeper bond with other group members in the group. In regards to the group specifically, another icebreaker activity can be where the leader has the members write on a piece of paper or poster what they hope to achieve in the group. This will help set a purpose and also helps the facilitator focus on any needs of the group or any themes that are consistently showing up. Lastly, another icebreaker activity can be writing a letter to the loved one who has passed. This will help the members self-reflect, and also help them be in tune with their feelings. The beginning of the group is also important for discussing the group's overall purpose. Part of the role of the facilitator, as mentioned, is to assess the needs of the group members and how to meet their needs. In creating and maintaining cohesion, the facilitator and group members must work collaboratively to define the purpose of the group. In going back to the icebreaker activity where all members write down what they hope to achieve, the facilitator is able to achieve this. The facilitator can also create a brief statement of the group's purpose, then allow the members to discuss the statement and make any desired adjustments or bring forth any suggestions to what the facilitator has proposed. It is also a great opportunity for the facilitator to include all members of the group and any new members and focus on the similarities between those that are present.
During the working stages, it is important to have appropriate communication and social interactions developed. In the initial sessions, the facilitator may find the members putting the attention onto them instead of engaging in conversation amongst each other. The group is still new and they're warming up to each other. So the facilitator must redirect that attention and conversation to the group members. This may look like asking provoking questions, asking for reflections, things of that sort. It is also important to establish these norms at the beginning. That way, group members know what to expect from each other and know how to proceed. Something else a facilitator must be aware of is of quiet group members, those who are particularly quiet and don't necessarily participate in conversation. This can lead to isolation of the group member and deter from group cohesion. The facilitator may reflect on their body language or comments they have said and simply ask what their reflection or opinion is on a particular topic. During the working stages, conflict will arise. It is the facilitator and the group members' responsibility to find that harmony. Oftentimes, individuals will continuously interrupt or give excessive advice. At this time, the facilitator should redirect the session by validating their thoughts or emotions, but refer back to those group guidelines. Something they might say is, "John, I hear you're frustrated. I see your opinion, but right now it is Tim's turn to speak. I would like to give him that time and space." Something else that may be highlighted is the uniqueness of each person's grief. We want to be careful not to overgeneralize. Everyone's not experiencing the exact type of grief, and it's not necessarily supportive of the process. When group members become exceptionally emotional, maybe excessively angry or crying, the facilitator can validate their emotions, but simply ask what would help them during that time. They may need the space to collect themselves outside, some privacy, or simply tissue and water. Also suggesting maybe, we can speak briefly after session if needed. During the working stages, we will also incorporate psychoeducation lessons. Our first lesson will be on grief. By discussing the stages of grief, members may be able to identify their emotions, label them, and find some common ground with others. We will discuss behaviors and coping mechanisms. A handout or visual may provide members a tangible reference to look back on later. Our second psychoeducation lesson will be on coping mechanisms. We will discuss the use of coping mechanisms and the positive and negative ones. Something that will be incorporated into our session will be practicing mindfulness. This may include breathing exercises and meditation. The facilitator will discuss the benefits, how to practice this skill, and what it will look like in the long term. An activity that we will incorporate will be sharing methods of self-care. Each member will write down their preferred activity on a piece of paper, whether it be spending some time alone, with family, listening to music, exercise. Put all the activities in a bowl, and the bowl will go around the group, and each person will select a new activity. Until next session, they will have the opportunity to practice that new method, and then they will be given the opportunity to reflect on it and give any feedback. To assess the members' progress in standing in the group, Scales can be used to develop conversation and cohesiveness. For example, the facilitator may ask, let's reflect on this week and how it has been for all of you. On a scale of 1 to 5, 1 being minimal and 5 being unbearable, how many of you identify as a 3 or a 4? And this would give members the opportunity to find a common ground, but also see the differences in each other's grief. It will be important to integrate the discussion regarding the differences in grief. Everyone may have similar emotions, but everyone's experience and process is unique. Nobody's feelings are labeled as right or wrong. In order to redefine the group purpose, check-ins would be appropriate. This gives the members time to reflect on the process that they have gone through and where they want to be. An activity that will be incorporated would be members writing notes to themselves or small notes at the very first session. They can write down their emotions, what issues they're experiencing, goals, and change that they want to see. After a few sessions, they can reflect back on that letter and analyze, this is how far I've come, or this is where I need to make some changes. And this allows the facilitator to adjust the group's goals.
In the ending or termination phase of a group, there are many different aspects that we need to consider. According to Toslin, this process entails making sure that the focus is kept on the session, that we look back on what transpired during the meetings of the group to see what it meant for the members, analyzing the significance of what occurred during the group, and examining what members can take away from the discussion and put into practice in their own lives. Some of the reasons why groups end, they can be as simple as there's a focus change for the facility that hosts the group. Sometimes groups end because of a loss of meeting space. Some groups end because there's a completion of the program or a graduation process, like in CBT formats. Sometimes there's just member loss of interest. And then also there can be where the group is really not willing to yield to external pressure to change their functioning or role as a group. For this group, we are a bereavement group. Well, bereavement groups are actually mutual aid or support groups. They're usually open-ended, which means that members can exit and enter at any time that they want, and that members can be in different places at the same time. There is no set length, no agreed upon number of sessions, and because of this group tends to have a greater longevity. So factors to consider when ending groups. We need to always remember that there's going to be an emotional attachment between the group members and between the group and the facilitator. Long-term members may actually experience a greater degree of anxiety when the group ends because they've had longer time to establish that relationship between the members and the facilitator. We have to consider the members' experiences. Everyone feels things in a different way, and we need to adjust our techniques and make sure that we accommodate individual experiences. We also need to make sure that we discuss in the last several sessions before the projected end date and make sure members understand when that is. We have to remember that there is emotional disclosure in these kinds of groups. So it's very easy for even the facilitator to become attached to the group members in that helping role capacity. So when we end a group session, we always need to have a plan for termination. We want to make sure that in this plan, we let members know what's going to happen when the group will end, and we have to encourage members to talk about how they feel about the ending of the group. Members should be given at least a 2-week notice. We need to remember to individualize members' experiences and adjust those techniques that we're going to use as a facilitator to accommodate that. We need to try to encourage member self-reliance and trusting that the skills that they've learned in the group will help them once the group is terminated. We also want to encourage member self-confidence, that the skills that they've learned, they can put into play when something comes at them that may overwhelm them. They'll understand how to deal with it and that they can deal with it. We also want to help members recognize and understand that they no longer need the group. By positively framing the accomplishments that they've made while in the group, that will help members also gain that self-confidence. We want to make sure that they know how to generalize the improvements over their life. In other words, how has this group made your life better? We also want to make sure that we lessen the stress of transition for our members by making sure that any issue that they have that can be referred, they are giving an appropriate referral resource.